Starting September 1st, optometrists in this province began a work action that means seniors and children cannot book appointments to get their eyes checked. With us now for the doctor's perspective in this fight with the provincial government, we're joined in Hamilton, Ontario, by Dr. Sheldon Salaba, president of the Ontario Association of Optometrists. Dr. Salaba, it's good to have you with us on TVO tonight. Can we just start by having you tell us, in your view, what led to the job action?
You know, we've been working with the Ford government to try and get them to come to the table and work with us to figure out a sustainable eye care system for patients in this province since the beginning of their mandate, but we've been met with silence. And last year in December of 2020, which was our last communication with them until August of this year, you know, we did everything that we could possibly think of to get the government to pay attention to this issue, and we were met with radio silence for 8 months. And back in March of 2021, when there was no funding announcement for primary care services in the province in the budget, we set a service withdrawal deadline of September 1st. And we're hoping that the government would engage with us to come to some type of solution. And they left everything until the 11th hour. We had some brief interactions with them over 3 days in August, and they would not commit to paying the operating costs for the services that we're providing. And unfortunately, services were withdrawn.
Okay, just confirming there are no talks happening as of this moment. Is that right?
That's correct. We haven't heard officially from the government since August 29th.
All right, shall we, I presume there's two possible explanations for this. One is that they really have it out for you guys and they don't like you. Or the other is, you know, we're in the middle of a global pandemic and they think they got bigger fish to fry. Is it more likely the latter than the former?
Well, listen, vision is our most important sense. And regardless of whether or not we're in a pandemic, I think you have to consider that these are essential healthcare services and they're services that need to be dealt with and managed. I think what we're seeing here, there's a history of 32 years of Ontario governments not taking action around primary eye care services. And I think that's where the real problem lies.
Let's do some of the math here because I think people need to have a better understanding that if, for example, they are going to see you and the Ontario Health Insurance Plan reimburses you for part of the cost of the service that you are providing, let's do the math. What does it cost and what does OHIP actually reimburse you for?
So we have multiple data points that indicate that the cost to provide a comprehensive eye exam in the province on average is around $80. And OHIP on average is paying $45. That 45 number has only increased $5 since 1989. And at that time, we were being paid $39.15. So if you take that $39.15 and inflate it over 3 decades, you're arriving at a number that's close to $80. And you know, we've done studies. We look at other jurisdictions. There are 4 other provinces in Canada that provide publicly funded eye care services. And when you compare apples to apples on what is being provided, the next lowest reimbursed province is Manitoba at 77. Following them is Quebec at 106. And following Quebec is Alberta at 137. So we don't understand why all these other provinces have been able to figure out how to resource these important services, and the Ontario government can't.
So just so I understand, is this to say that every time you deal with a patient who needs to use the health insurance plan to see you, you're losing money?
Yes, we're paying to see those patients. That's correct.
How does that make sense?
It doesn't. That's why such a drastic action is being taken, because we have to break this logjam with the government. They need to understand from the public the importance of these services to people, and they need to resource them correctly. You know, optometrists in this province are offering to still work for free, so the optometrist isn't going to receive compensation. But if they're reimbursed at the $80 level, that's going to cover their costs like rent, staff salaries, insurances, equipment rental, utilities. That is what it costs to provide a 20-minute to half-hour service to patients in this province.
Let's also understand the kinds of patients that you see. Now, the kind of dispute you're having with the province right now would not cover, for example, somebody whose eye care is covered by a workplace private insurance situation, right? This is only for the people who rely on OHIP to get these services. Is that fair to say?
Yeah, but that's a large portion of the patients we see, on average 70% in our practices. So you're talking children, seniors, and adults with medical conditions. And that's a very large portion of the population.
Okay. The province says that it has offered a $39 million lump sum payment and an 8% increase in the amount paid, and to align future increases with what other physicians get. They say that's what they've put on the table. What's your reaction to that?
You know, linking us to physicians in this province isn't fair because physicians haven't been treated the way we have over the last 32 years. So it's not really an apples to apples comparison. If they want to link us to future physician increases, I think they have to go back 32 years, not 10, and give us the same increases and decreases that physicians have experienced over that period of time. And then we're going to come out at something that's fair. And that number is again going to land at around $80. Um, they offer a $39 million lump sum payment that is retroactive for the last decade. That we performed 34 million services in the last decade. So that number represents about $1 per service that we provided. The 8.48% increase on our existing fee codes would represent about a $4 increase. So if you lump those two together, you're going to see on average the reimbursement for an eye exam move from $45 to $50. And that's still going to see the optometrist paying $30 to subsidize those costs to see patients. So that is not a sustainable system that we're creating here. The other thing I'd like to say on that point, if I can, the government says that they are trying to lay a foundation to work reasonably with optometrists in the province. And I just want to point out that in August, we had a 2-hour meeting with them on August 5th, and then we had 2 days of mediation. Then they released the 39 million and 8.48% offer publicly. That is an act of bad faith bargaining. That was what they offered us inside of a confidential mediation process. And 2 hours after the mediation ended, they put that number out publicly. The other thing that I'd like to point out is the 39 million that they're offering is a bargaining tactic, and it's a waste of taxpayers' money. When under typical compensation negotiations between service providers and the government, it's unlawful for them to be able to offer an offer like this publicly uh, during this type of compensation negotiation. So none of the actions that they're taking are providing any trust to us that they are actually interested in ever funding what it costs to provide these services.
No, I hear you, but the tricky part of this, of course, is that this is not just a negotiation at a bargaining table; it's also a public relations fight. And at the moment, you're telling people, seniors, younger people, for example, that because of your fight with the province of Ontario, they're going to have to go seek their eye care in emergency departments in hospitals, where A, it's infinitely more expensive, and B, there's probably a wait list up the yin yang because of all the backlog for procedures that have been delayed by COVID. So how is that consistent with the best care of your patients, which I know you folks like to give?
You know, you have to understand that in a system like this, we aren't able to deliver the best care that people in Ontario deserve. And what we're doing is fighting for our patients' rights to be able to have access to these high quality services. This is not an ideal situation. I'm shocked that the government would be so cavalier and leave things to the last minute and then behave in a way that does not instill trust in us as service providers in wanting to work with us reasonably to ensure that primary care services in this province are no longer funded the lowest in Canada. So I feel bad, and so do all of my colleagues, that we're not able to take care of our patients right now because we're doctors. We want to be able to help people see, make sure seniors can lead independent lives, treat eye diseases, all of those types of things. But at this point in time, because of the actions that the government are taking, we're not able to do that. And so people that have been scheduled for routine care are going to experience delays. We're going to make every effort when patients call us if they are having an emergency. We're going to make sure that they're taken care of properly. But really, the government needs to come back to the table and make a commitment to ensure that primary eye care services in Ontario are no longer funded at the lowest rates in Canada.
No, I take your point on that, but let's finish up on this then, Dr. Sheldon. Um, you guys are well paid. You should be well paid. You spent a lot of time going to school to develop the expertise to perform the services that we need you to perform. But again, going back to this being a public relations fight, if the government is able to portray you as six-figure income people who are putting your own financial needs ahead of those of your patients, how exactly do you come out of this with any glory?
Well, I just think that that's simply not true. We aren't able, like practices are stressed out and we're unable to provide the same quality of care that patients receive in other parts of the country. So I don't think that the government is successfully portraying it that way. Our patients are supportive. They value the services that we provide. They value the time that we take with them. We help them navigate very stressful situations if anything ever happens to their vision, and they appreciate that. The patients also understand that a $5 increase over 32 years is ridiculous, and they understand that the government is playing games. So, we want to work with the government to fix this problem, and we want to be able to reinstate our services and be able to start taking care of patients again.
Understood. Dr. Sheldon Salaba, President of the Ontario Association of Optometrists, we appreciate you sharing your views with us on TVO tonight. Thank you.
Thank you very much. Take care.
And now for the other side in this disagreement, we welcome in Midtown of the provincial capital, Robin Martin. She is the parliamentary assistant to the Minister of Health and the PC member for Eglinton Lawrence. And Robin, it's good to have you back on our airwaves. How are you doing today?
Very good, Steve. Thank you. How are you?
Glad to hear it. Not too bad at all. Let's just hit this right off the top. Do you think, in your judgment, the province of Ontario has made a fair offer to the optometrists?
Yes. I mean, as you pointed out, we've made a $39 million offer, which is a retroactive payment. And what we're trying to do is show good faith to the optometrists that it's a kind of a catch-up fee for 10 years, going back 10 years since they've had an agreement. Which ended in 2011. And it gives them $39 million. They're going to see it on October 5th in their remittance advice, and it will flow on October 15th. And that's regardless of whether the OAO comes back to the mediation table or anything else, or whether we get an agreement. However, it is a sign of good faith, and we're hoping that the optometrists will respond in kind, in good faith, by continuing to provide what Dr. Salaba, in the interview you've just done, said are essential medical services for seniors and children, and also, show us their costs so that we can come to an agreement about what is an appropriate fee.
I talked math with him, so let me talk math with you. How did you arrive at the $39 million figure?
Well, it's basically going back and looking at the increases that physicians have had over the 10 years and doing the equivalent for optometrists. And so it's a catch-up kind of a fee. We've also offered to increase the OHIP fee immediately that they're being paid by 8.48%, which, given the constrained fiscal environment in which we're operating right now during a pandemic, is generous, I think, and is a good starting point for discussions. We're not saying that's the end of it, but we need to see evidence to go over in detail what their costs are. Remember that optometrists in Ontario provide OHIP insured and patient pay services like selling contact lenses and glasses and non-publicly insured services. And so their costs are kind of complex to calculate, right? They would be different depending on patient mix, the types of patients they get, their rent, how much technology they use. Any number of things would factor into, what their costs are and what their revenues are. And, we're having an increasingly digital healthcare system. It's really burgeoning with digital technologies. And that's also impacting how optometric services and other services, other health services are provided. So we need to go over all of this in great detail with them.
No, appreciate all that. But let's, again, going back to the math here, just see if you agree with his basic premise, which is that it costs them $80 to provide the service, and OHIP basically reimburses $45 of that. In other words, they're losing money every time they see those patients. Do you acknowledge that?
I hear you, Steve, but honestly, we don't know what it costs. That's what they've said, it costs. But we don't know what it costs, because that's why we have to get back to the table and do that work and look at all those services that they're providing and all of those things I just went through. We don't know what it costs. We can't just take their word for it. That wouldn't be fiscally responsible as stewards of taxpayer dollars. And frankly, they're being a bit disingenuous about the way they represent the coverage of eye care or vision care across the country. I mean, Manitoba may have a higher fee, but it pays it only once every other year, not covering every year as we do in Ontario. So there's a lot of other things to consider. A lot of provinces don't insure or cover optometric services at all. 6 of them don't provide seniors eye exams. 5 of them don't provide annual exams that are insured for children. And I think Ontario is the only province where you don't have to pay for an insured service, publicly insured service, out of your own pocket. So there's a lot of differences to consider. And we're not getting the full picture in the talking points from the OAO. And I think it's important that we understand all of those things so we can come to an agreement and, make eye care sustainable across Ontario, as we want to do. We want to continue to fund these services. We know that they're important to people. I think Dr. Salaba himself said that these are essential services. So not providing them and sending people to emergency rooms and hospitals in the middle of a pandemic is very disconcerting.
No, I know. I appreciate your point, but he would also say that the use of the term talking point for the money involved here, which they say is a third-party accounting firm calculated number. This isn't their quote-unquote talking point. It is something that a third independent party came up with, that it costs anywhere from $75 to $80 for them to provide that service, and yet OHIP only reimburses, not even about half of it. That in their view, that's not fair. I still think we need to get back to the issue of how you would convince them that they're in a fair situation when they're losing money every time they see a patient.
But Steve, I'm not trying to convince them that they're in a fair situation and that there is nothing else to be done here. I'm trying to convince them to come back to the mediator's table, to accept the mediator's condition, as the ministry and the government have done, and to be there to look at those costs in detail. We've promised to set up a joint working group to do that. And all we want to do is look at their costs. They say we're not covering their costs. Let's see what those costs are. If they want us to cover their costs, surely they should have no problem in sitting down with us and going through that. The study that they commissioned is a representative, well, it may not be a representative example. It is 74 optometrists out of 2,500. Are all their costs the same? Probably not. I'm sure, like I said, that many optometrist costs differ given the nature of their practices. And, that there's a whole lot of things that go into that. So I think that's what we need to get together to talk about. I just want them to come back, to talk with the mediator, a third-party independent mediator who's well regarded, and to go through this with us instead of, having a fight in the media about, essential medical services. We want those services to be delivered. on an ongoing basis to the people who need them.
All right, maybe you could speak to those people right now then, because if they cannot get appointments with their optometrists in order to get the service that they have relied on in the past, and if their optometrists are now telling them, go to your emergency department at your local hospital and let them handle it, what advice would you have for those people on how to handle that situation when almost certainly they'll be waiting 6, 12, who knows how many months for that service because of the backlog and everything else right now?
Yeah, I mean, it is a very unfortunate situation. And so my advice would certainly be to look for another optometrist who is providing the service, because some are providing the services on an ongoing basis, or go to the College of Optometrists. The College of Optometrists regulates optometrists, and they have professional obligations to provide these services. And the college has said that they will help patients to ensure that these professional obligations are fulfilled and that they're getting the services they need. So that would be my advice. And frankly, I'm sorry for the inconvenience that people are going through. But honestly, I don't understand how anyone can expect to get a deal without coming to the table and talking about the very issue that they think is the issue, which is overhead costs and how they're being compensated for those. They can't just expect us to accept on faith what they have said is the number for something that is so complicated. And also, we don't have all the evidence. We don't have all the information. We do this with other health professionals all the time. We come to negotiated deals, and other health professionals, frankly, the expectation is they'll continue to provide these services, and that is the usual practice while we're negotiating.
All right, just finally then, would you expect them to be satisfied being the 10th best paid optometrist in the whole country? Because that's what they say they are right now.
Yeah, again, I think that we don't have the full picture of even how they're paid, because they get paid for other OHIP insured services, not just the eye exam, which is the one they're referring to, and we don't have the full picture of what their costs are, and what their revenues are generally. So I think our optometrists are great service providers. We want to have a deal with them. We respect their abilities and services, but honestly, healthcare in Ontario is changing, and we need to sit down with them and understand what their current costs of services are. And work through that together so that we can come to some kind of a deal. And that's all we're trying to do. And if they don't come back to the table, I don't know how that happens, because I think, if you want to negotiate something, you've got to be there to negotiate it.
That's Robin Martin. She's the Parliamentary Assistant to the Minister of Health for the Province of Ontario and the PC member for Eglinton Lawrence. Robin Martin, we're grateful to you for coming on to TVO tonight and sharing the government's position on this. Thanks.
Thank you, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.